Awesome. Can you all hear me? Sounds like it is working. Well, thanks so much for coming here on a Friday afternoon, like the previous speaker said. Very, very impressive. We're going to be talking about social media, but we're not talking about the type of social media where you search up how to do a rare YouTube procedure real quick before you do it. We're going to be talking about medical misinformation and how social media plays a role and how we have a role in combating that. I have no disclosures. No one is paying me for this talk. And I'll leave these up, and you can kind of read through them while I introduce myself. So born and raised in Houston, Texas. I went to UT Austin for undergrad, went to med school at Oklahoma State University, and then completed my residency at UT Health San Antonio back in 2021. And then I've moved back to Houston since then and practiced at one of the large hospital systems in Houston. So you're probably asking, what does this guy know about social media? Why is he talking to me about social media? Rewind back to March of 2020, and I think we all know what happened then. There was an infamous conference, CORD, in New York City. Myself and a few fellow residents went to New York City. We obviously went to the conferences and the talks. We went to some Knicks games. We went to some fancy restaurants, had a great, great time. I then come back to San Antonio, come to one of my shifts, and kind of midway through the shift, I'm a little cold, so I put on a jacket. By the time I get home, I have like a 104 fever, I'm shivering. Long story short, my co-residents and myself were one of the first 4 publicly confirmed COVID cases in San Antonio. And so we obviously had to quarantine for more than 14 days because we were healthcare workers, what are the guidelines, when can we go back to work, that kind of thing. And I got kind of stir crazy about a week into that. And so at that time, we were kind of going through virology 101 as a country, right? We were all asking questions about hand washing and how do viruses spread and whatnot. And being bored at home, I started tweeting about things like that. And some news producers caught wind of that and said, hey, you want to come on our channel and talk about that? And I did that, and that turned into another appearance and another appearance, and it turned into probably too many appearances. But that was kind of my foray into the media space. That's obviously led to a lot of opportunities. I've gotten to speak. I'm obviously speaking here. I'll be speaking in Amsterdam about emergency departments in the post-pandemic world here in a couple months. And then, as they had mentioned, STEM City is, I kind of got into the science communication space, kind of making sure that we talk about factual things, highlighting folks that are professionals in science, technology, engineering, and math. And so that's a picture with the 4 Artemis astronauts that will be going to the moon next year. So why should you care, right? I've cared for a while. Why should you care? Social media's got a lot of stigma around it. It's ruining our lives. It's ruining the development of our kids. There's lots of misinformation there. Why should you care? Foreign governments are maybe spying on us. And so I said I graduated in 2021 in July, and if you think back to that time and you look at that little graph, that was right before we had our biggest surge of COVID cases. I wanted to live in Houston and work in Houston, but if you recall, the job market was fairly stagnant and there weren't any jobs. So I moved back to Houston and got a job in Beaumont, Texas, and I worked at a large hospital and then the affiliated freestanding with it. And so that was my first job out of residency, and like most hospitals and whatnot at that time, we saw lots of COVID patients. Some of them were sick, they got oxygen, some of them got intubated. And so dream job out of residency, right? Freestanding, intubating people, managing them for many days on end. And I still think back to this one patient, 50-something-year-old gentleman who came in hypoxic, put him on oxygen, and then offered him the standard of care at that time, steroids, some other medications. He was refusing all those medications. He had a list of medications that he had heard about from an online influencer type person saying, I want these medications. A, they were not the standard of care. B, we didn't have those medications. He didn't get those, so all he would want is oxygen. He ended up getting intubated a few days later, got transferred out of that facility, but I kind of followed up on it, and unfortunately he passed away. What really stands out to me in that situation is when they were transferring him and kind of cleaning the room, there were boxes of those supplements and medications that his family member had actually been sneaking into him, and they were found under kind of the mattress in bed. And so that just really sticks with me that, we were trying to give him the best care possible, but he just simply didn't trust us, and he still kind of was being impacted by what he was hearing at home, online, on the internet. And so I tell that story because what happens out there ends up in our emergency departments, whether it's that situation, whether it's a Tide Pod challenge, whether it's a cinnamon challenge, or whatever crazy thing we're going to have this year, the consequences of that end up in our ERs. And I also want to point out that no one wakes up thinking, hey, I want to harm myself. The issue is access, right? People come to our ERs, they have to wait hours and hours. Sometimes they get dispoed from the waiting room. We give them a follow-up, and that follow-up might not be for weeks or months or even longer. And so they want information, they want a solution, and when someone's offering them that solution as something that they can get instantly or easy, that's why they succumb to that. And so we shouldn't be blaming the patients or the folks that kind of take these treatments. We just unfortunately live in a system that doesn't function so well. The other kind of thing I get a lot when I have these discussions is, people don't care about what I have to say. They care about the influencers. Well, Gallup does this survey every year, and if you look, we are consistently in the top 5. You've got nurses, rightly so, very trustworthy folks. Obviously, we care about our pets a lot, so they're ahead of us. I'm not sure how the dentist ended up there. We need to figure that out. But obviously, we are consistently in the top 4 or 5. And so people do care about what we have to say. Just think about how many times in the ER, a patient might be like, hey, can you be my primary care doctor? They really care. It's just that, the access is the issue. Raise of hands, anyone know who this guy is? One person, or 2 people, okay. So he's the Liver King. He's an online medical influencer. His kind of thing is that he lives by these ancestral tenets, and if you guessed, one of his main kind of things is eating raw, unprocessed organs will kind of make you look like that. And of course, he's got some supplements to sell, so you take those supplements and you're gonna be looking like that. Of course, last year, some of his emails got leaked, and he spends $11,000 a month on steroids. But the reason I kind of show him is that he's a good communicator. Say what you will about him. He's a great communicator. He's able to cultivate an audience and sell them an ideal. And as clinicians, we shy away from the word business or marketing, but the fact is that we are in the healthcare business, and what we have to sell is good quality healthcare that is fact-based, that is going to make people's lives better. We're good communicators. As I mentioned, we kind of bring down these complex topics, make them really simple for our patients. They want us to be their primary care doctors. So we've got the communication down. What we shy away from is communicating on social media and some of these 21st century platforms. This guy's really good at that. Politicians are really good at that. We can be good at that if we make that effort and show up on those platforms. And then looking at it from a national perspective, the Surgeon General put out this report last year, Confronting Health Misinformation. It's kind of hard to read down there, but one kind of big part of that report is how do clinicians work in this area? And it's by showing up on media and social media and spreading factual information. And so this is something that is on the national and international radar, and it's an official recommendation from organizations like the World Health Organization or the Surgeon General, and many other credible folks. I'll skip this for time's sake. But when we speak about misinformation, a lot of times we speak about it as something that's new in the age of social media. It's not new. Grandma said that the soup's gonna cure your cold. Now, is that bad information? Is it misinformation? Yes. Is it gonna cause harm? No. But of course, we all know about the snake oil salesmen of the 1920s and 30s who sold cure-all potions. And then when the internet came along, we've had things like fad diets and pills that are supposed to make everything better without you having to do anything. And so misinformation's been around as long as humans have been around. That's not the problem here. Well, it is the problem, but what has accelerated it is social media. And so there was a study published in Science a couple years ago, and misinformation spreads at a rate of 6 times higher than factual information. And they looked at this on Twitter in particular. And there's a few reasons for that. First of all, think back to when your favorite athlete gets injured. You immediately copy that link and send it to a friend. Or something major happens in terms of a breakthrough about something you're passionate about. You may not read everything. You have that excitement of touching base with that other member of your friend circle that may be interested in that and sending that. And so the fact that you can kind of share this information so quickly, that's one reason. 2 is that there's no deliberation. And so there is no, hey, this newspaper article came out, I have to read it, a family member maybe asks about it, and there's this back and forth. It's literally copy, paste, send. And then there's confirmation bias. So you send it to a group chat, goes to another group chat, somehow comes back around to you, and within a span of a few hours, you could have seen the same fact of information 3, 4, 5 times, and so you're like, hey, it's gotta be true, right? And everyone's sharing it, it looks true enough. And so that's why misinformation, when it comes to social media, spreads so fast. And so hopefully by this point, we are all on the same page of misinformation, especially medical misinformation, is a major problem. Social media is contributing to it. And so then what do we do about it? So just kind of quick show of hands. Over the last week, who in here has used Facebook? Okay, Instagram, TikTok, not very many people, no one. Okay, and then who in here uses social media in a professional setting? So we probably all use it in a private setting, but I saw one person and that's about it. No, a few people, okay. So we could talk about social media. It could be a graduate level course that could last an entire semester, but I'm just gonna touch on kind of a few basic things that I've kind of personally noted. So they're not all the same. What's your audience? If you're trying to create content that reaches a 19-year-old, Facebook's probably not going to do it. It's probably going to be TikTok. If you're trying to reach someone who's 60, maybe Facebook's a better option. And then what's the purpose of that? Are you trying to share medical knowledge and information? There might be certain platforms that are better for that, like LinkedIn. Are you trying to find collaborators? LinkedIn might be great for that. Are you trying to warn kids against a new challenge? That might be TikTok. And so just because you have a certain set of ideas you want to put out there, you have to really kind of fine-tune exactly which one of these platforms is best for that message and audience and share it on that platform. And then there's the idea of supply and demand as well. So for example, if I hold a phone up and I talk about like a virus and I post it to both TikTok and Instagram, I might have 100 followers on both. On TikTok, a few hundred people might see that. And that's because there's way more demand for content than supply. On Instagram, even with the same 100 followers, 50 people might see that. And so knowing which platforms are, lacking that content and then providing content for those platforms to reach as many people as possible. And so I still call it Twitter. I'll probably always call it Twitter, but X is, I guess, the official name. So I'll just kind of go through a few of the kind of trends on each one of these platforms. So Twitter is going to be great for the emergent kind of getting the message out. There's a measles outbreak. There's lots of questions, getting hashtags when it relates to that topic, posting about that. That's going to be great on something like Twitter. As you know from my story, obviously, lots of media folks will reach out to you when you post on Twitter. They search for these hashtags, so like hashtag measles outbreak Houston, and they'll see like, oh, this person's a physician. Let me see if they can give me some insight into exactly what's going on. You can reply directly to folks, and so if someone is asking a question like, hey, so-and-so has this condition, should they go to school? Maybe you can comment. Obviously, you shouldn't be giving official medical advice on social media, but just general kind of broad strokes kind of stuff. Not great for long form stuff. So if you really want to share kind of well thought out ideas that are more academic, obviously you can share your articles, get exposure from, but in terms of native content on Twitter when it comes to that content, not the best. LinkedIn, yes, I promise people use LinkedIn. I would roll my eyes when people talked about LinkedIn all the time as well. Over the last year and a half or so, I've realized the utility of that. Much better for building networks, right? So say you're an emergency medicine director in a rural setting and you're facing a certain problem. Posting about that problem, asking questions, finding a network of similar folks in your position, that's what LinkedIn's going to be great for. Finding collaborators in research, that's what LinkedIn's going to be great for. And then TikTok, everyone's favorite platform in here because everyone uses it. I promise you it's not dancing teenagers anymore. It hasn't been dancing teenagers for 5-6 years now. Of course, that still exists, but think back to Instagram, right? It was like the photography app in 2011 where everyone posted these amazing images, and now it's where we post family pictures and informal content. That's what TikTok's begun too. There's physicians and engineers and news reporters, and everyone's out there. And if you want to reach a younger audience, a lot of the audience that is susceptible to misinformation and bad information, that's where they're at. Everyone under 30 is on TikTok. And as we'll see on the next slide, if you look at Gen Z, TikTok is the #1 place where if they do get their health information on social media, that's where they get it. And so millions of folks use these platforms to get health information. 33% of Gen Z, 26%, 14% for millennials and Gen X. And as you look, they use all types of platforms, TikTok, Facebook, Instagram. Baby boomers, maybe not so much. These organizations, such as the White House, the CDC, so many other massive organizations that are credible, use these platforms as well to get their information out. So there's not this sense of like, hey, I'm a physician on TikTok, maybe people are going to think or not take me seriously. All these organizations are on TikTok. And then there's the entertainment aspect of things, right? Where we are physicians, some of us are comedians, some of us like to do funny things. You might not be able to do that in an academic journal, but it's okay to show your bright, kind of colorful side on these platforms, and no one's going to judge you for it, and maybe it'll get you more exposure and a few more views. And so mental health has obviously always been a big issue, but post-pandemic, when we all became isolated, when there hasn't been the supply of psychiatrists and mental health professionals over the last couple years, that problem has gone exacerbated. And we all see that in our ERs. And so this kind of little example takes a look at 500 videos that were posted on TikTok around mental health. And those 500 videos got about 25 million views and all of these other crazy, outrageous numbers. And then they had psychiatrists look at these videos and characterize them and say, hey, what was good information, what wasn't? 83% of it, on one level or another, was misleading in some way. So not necessarily completely wrong, but misleading. 54% gave good advice, but 31% was not so good, and 14% led to bad recommendations and bad information out there. And so this shows that, millions of eyeballs are looking at this content because they can't get access to the mental health system and healthcare in general. They turn to these social media platforms, and unfortunately, a lot of the information they get is not good information, it's bad information. And so I know there's probably a bunch of you that are still like, I'm never going to be on social media. And I wish that wasn't the case, but that's okay. You still work in hospital systems, right? So if you work in a large hospital system in a major metropolitan area, yeah, your hospital probably has a big social media department and a team, and they're putting out good information. But once again, what if you work in a freestanding ER that you run, or you're in a rural setting? Does your hospital have that? If they don't, maybe you don't want to be the face of that, but talk to your chief marketing officer or talk to your directors and say, hey, what are we doing about this? What's our public face when it comes to putting out factual, accessible medical information? We also have to think about this from a digital transformation strategy kind of picture, because access is the issue. So does your hospital, does your freestanding ER have any type of telehealth services, newsletters, text platforms? Because the more access you have, the more people will use that access and not turn to these other sources of information that may be harmful. And so hopefully, the flip side of things is everyone in here is like, hey, I'm going to have a professional-facing social media account after I leave here. And that would be the most amazing thing. What I'm not asking you to do is be a keyboard warrior. So don't attack Lever King and don't attack his fans and whatnot. They can kind of do their thing. What I'm asking you to do is post about the things you're an expert at. Are you the IT guy that knows everything about EHRs? Are you the AI guy that is terrified of what's coming? Post about that. Are you passionate about social determinants of health, or as in the talk before, about the opioid crisis? Post about that. It's all about being in the community so people know that we are on these platforms, and then maybe because people see you, they ask you another question, and you can direct them to a clinic or a resource or whatever the case may be. So start with what you know best and go from there. You don't have to be a know-it-all and an expert in all issues, but starting with something is better than not having any presence. A few other things that either I personally have seen from social media or I've seen colleagues kind of benefit from is finding research collaborators. It's so hard to, maybe you're not in a large academic center, you want to do research and you don't know how to get collaborators or funding or whatnot. I've seen folks use that. I've seen folks, get invited to talks and conferences because of their social media presence. And then do no harm, right? That's the Hippocratic oath that we all swore. And there is this massive misinformation epidemic going on that is fueled by social media. And we simply can't ignore it. We have to be at the table, at the water cooler where people have these conversations and make sure that we are putting a face for our profession. And so these are just two examples of folks that I really kind of look up to. The one on the left, Dr. Adam, he is an ER physician. He's out of DC, and he creates content for med school and residents at the time. So it's all about these quick videos about, hey, this is going on. What do you think the diagnosis is? And then he goes into, what he saw, and they're basically quick cases that he does. And that's his kind of lane. He doesn't talk about the new pandemic coming down the pike or new medical technologies. He stays in that lane. This is Joel. He's massive on TikTok. He's actually a medical student, and he talks about race in medicine. So a lot of his videos are like, how does this dermatologic condition present in a black person versus a white person? Because a lot of the standards that we learn in medical school are based on, maybe white males from the 60s. How does that look in different races? How does that impact things? And so that's what he focuses on. And so as you can see, it doesn't matter what it is you talk about, as long as it's obviously factual and it's something you know best, and you can put it out there. And so I'm happy to answer any questions now or after this talk. Of course, I gotta plug my own social media. So see you on social media, and thanks so much for listening to this talk.